Right, we will make a start then. So good morning and welcome everyone to the 6th session in our webinar series on poverty related topics. My name is Karen McFarlane and I'm the Policy Officer for Poverty and Vulnerable Children at Children in Wales, and I'll be chairing today's session. Now, before I hand over to Lisa, who's our speaker today, there are just a few items of housekeeping that I need to go through with everyone. So the webinar will be recorded and will be available to view on our website from probably about next Wednesday. Your camera and microphone will remain off during the webinar. However, we do still encourage you to ask questions. So given the number of attendees we have, we can't make this webinar interactive in the traditional way. But if you do still have any questions, I would encourage you to post them into the chat whilst we go through the presentation. I'll then put your questions to Lisa during our Q&A session towards the end. So because of this, can I just ask that the chat function is only used for questions? Thank you. I'd also like to confirm that we will send everyone an email with a copy of today's slides, along with a link to the recording once we get that up onto our website. And again, we aim to get these to you by Tuesday, Wednesday next week. And the email will also include links to all of our previous poverty webinars, just in case you've missed them. You're very free to forward these on to colleagues or people that didn't attend today. And finally, towards the end of the presentation, we will post an evaluation form into the chat. The form has just 5 questions, and can I ask that you all take the time to complete this? Your comments are important to us and they really do help us plan our future webinars. So we'll post that in the link just before we go into the chat, just before we go into the Q&A session. So today I'm delighted to welcome Lisa Goodyear from Betsy Cadwaladr Health Board, University Health Board. Morning, Lisa. And Lisa is the lead manager for operational support and protect. She'll be sharing the amazing work and partnerships of the North Wales Community Support Hubs in building personal and community resilience against the effects of poverty. So a huge welcome, Lisa. Thank you.
Thanks very much, Karen. And thank you everybody so much for coming along today. It's a really wonderful opportunity to have the chance to speak to you all and talk to you about what we've been doing in the North. I just wanted to start off by putting the community support hubs into some context, really. We were established in June, July 2021 as a bit of a pilot project using funding through the Hardship Fund from Welsh Government. And we were initially called COVID support hubs. And the reason for that was that, we handed out LFD tests so we could make those more easily accessible to members of the communities. And we could provide some sort of crisis interventions, things like food, things like accommodation challenges, debt, employment, those kind of things. So some very sort of critical issues that some of our most challenging communities were facing at the time. However, as time progressed, we took the opportunity to, sorry, I can just see there, I'm not unable to mute, okay. We took the opportunity to change the delivery model slightly, and of course, as we started to recover towards later in that year, although be it temporarily, we added a lot more different support functions into our community support hubs, so we could be more supportive of communities during the times that they were changing, during the times when they were maybe getting back on their feet a bit, but also some of those times when people were starting to feel the real impacts of COVID. So at the moment, we've got about 16 hubs. We've got a couple more coming on later this week, towards the end of next week as well. And our hubs are mainly led by third sector organisations, always with an existing presence. So we don't parachute new organisations into communities, and they're all located in non-statutory buildings. We think that's really important because very often, as you'll all be aware, when people are facing challenges with regards to their personal situation, where they're asking for help that might have an impact on their levels of dignity, they don't want to go into somewhere statutory that's often associated with enforcement or bills or that sort of thing. So they're all located in non-statutory places like churches, community centres, etc. We use existing providers of community-led support services. So again, we don't double fund what's already out there. We don't reinvent the wheel. We work with about 160 third sector support services across the whole of North Wales. and we make the best of use of their funding. But actually, we also work with them long term to support them to become more sustainable as a third sector organisation. To date, we've accessed over 40,000 customers. Those 40,000 people have walked across our doorsteps for a variety of different reasons, and we're able to provide information on that in terms of recording why they come to visit us, what happened, and how their life has changed as a consequence. And as I mentioned very early on, one of the key engagement mechanisms that we use is handing out LFD tests. People don't have to hand over their names and addresses or anything for that. They just pick up a pack. But what we do is we make sure that we have a leaflet attached to the front of each of the LFD packs, so people know what goes on in the hub. When they pop in for a packet of LFDs, they can sit and have a panad and a chat with people, or they can just wander off and come back again at a later stage if they want to. So that's really our operational model. It's very simple. It's not groundbreaking. It's not rocket science, and it's been done before. The locations that we are in at the moment, you can see there we've got phase 1. So we've got Holyhead, and that's managed by CAB. That covers the whole of Anglesey Island. We've got Maeskerken in Bangor, and that's run by Maesni. We've got a hub Dinbych in Denbigh, that's run by Group Cynefin. The only one of our hubs that's actually led in the background by a local authority is Shotton, and that's Rivertown Church. So actually it's Rivertown Church that run it, and Flintshire just support them, Flintshire Council just support them in the background. But they are a fantastic council. They're very proactive and very forward thinking, and we're really grateful for their insight and as being a partner on board. We have Kevin Mawr, which is the Plasmadoc community-owned leisure centre in Wrexham. In phase 2 there we have Conwy, and that's run by CVSC. CVSC also have about 11 microsites across the Conwy county, because it's a very rural area, and actually Anglesey have 9 of those as well. In phase 3 we've got Pwllheli, that's run by Felin Fach. In Bro Ffestiniog it's Drefwerth. In Llandillas we've got the community centre. In Holywell in Flintshire we've got Cyminspire, and in Gwesit we've got Aval. In phase 4, which we're just finishing off now, in Buttonog we've got Conglemenciau. In Bala we've got Canalfon Hemblas. In Carnarvon we've got the town council, which is very different, and Drefwerth. In Llanarhen we've got the community centre, and Penygroes we've got Group Cynefin again. And at the bottom there we've got some of our target lists. So Coed Mawr, and there's another one in Bangor. But as many of you know, when we've got larger communities, very often don't want to travel to a different part of the community to access a service. We'd like to work with Junction, Pensarn, Rhyl, Prestatyn, Corwen and Flint. So there's quite a few areas there that we'd still like to get into. We're also very much aware that lots of different organisations and groups also set up hubs. So they don't have to be a hub to join our network that's actually established by Betsy Cadwallader. Any hub can link up with our network of hubs, and the important thing is that we all work together in partnership. We all want the best for the customer, and we all make sure that we're working together to share customers, to get better outcomes from them, and make sure that they are able to be supported to achieve outcomes and sustain those outcomes, and not setting their priorities too high, so they inevitably don't work out, and they find life difficult and don't engage with support services anymore. So I'll go on now very briefly to the type of support offered. So we have got quite a wide core offering here, and as I mentioned earlier, Betsy Cadwallader don't actually deliver many of these services themselves. They are delivered by the wide range of third sector organisations that we have working with us. So we have lateral flow devices, and so all of our hubs have an account with Welsh Government, and they take charge of their own lateral flow devices. They dispatch them, they make them available to the community, and they record and report on them every week. We have something called Food Plus, and that is a wide variety of different food offerings. So very often our hubs will partner up with a food bank or numerous food banks in the areas. In some of our areas where we've got hubs, the food banks actually locate themselves in our hubs, because that means that actually we're able to target some customers that wouldn't ordinarily walk through the doors of a support organisation. We offer a variety of cooked meal services, so like Meals on Wheels, etc. And those are very often made by community groups that are doing volunteering, etc., in the right setting that's been inspected by the relevant EHO and complies with legislation. We also do cooked meal classes as well. So we work very closely with Public Health Wales and other organisations that are able to deliver classes either in person or remotely or using WhatsApp, and things like, for example, cookery meals for people that have diabetes, cooking for a family under a fiver. Many of you will have heard of the slow cooker approach as well. We're able to deliver those and numerous other types of classes. In some of our hubs, what they do, where they've got particularly good links with groups, for example, of people that have been experiencing domestic violence, they'll do things like, making cookies and things like that. And actually, it's not really about making the cookies. It's about getting people to work together in a shared environment, making links and hoping to make themselves a bit more resilient going forward. So very small things like that through to big sort of sessions with slow cookers where they're taught, remotely. They set up WhatsApp groups during the cookery course so they can all have a chat and share a giggle and share recipes and stuff like that. And we often work with food banks and community fridges as well, which quite a few of our hubs have got to source those ingredients. Accommodation tenancy support is quite a straightforward one, but it deals with everything from I have nowhere to sleep tonight through to I have mold on the walls of my children's bedrooms and they have respiratory conditions. It deals with everything from I need to get a tenancy and I have no idea where to start, through to I'm at risk of losing my tenancy because I haven't paid my bills or we have antisocial behaviour going on in the area, that sort of thing. So everything to do with accommodation. Money and debt and management advice, benefit advice and support, better health calculations. Again, we're able to deal with a whole raft of things through to people that have got very significant debt problems, through to people that actually aren't even too sure that they can even claim benefits. The forms are very big, sometimes they're complicated, sometimes they can't get online. We'll do them with them. And are they actually better off claiming benefits or entering some sort of employment? And we do all that with them. Those two interventions particularly are really, really popular in terms of being delivered over WhatsApp and FaceTime. And the reason for that is that very often the customer will have lots of pieces of paperwork that they need to share with an advisor. It's quite often we find that people find it themselves under a lot of pressure, getting everything together, getting down to a community support hub to have a conversation with somebody, only then to maybe have to come back the next day or later on the day to provide extra paperwork. By doing things via WhatsApp, we're able to do the thing while the consultation, while the customer's sitting on their sofa, maybe in their pajamas with a panad. They don't have to worry about getting in a car or getting public transport or walking down to the hub. They can take pictures and screenshots of documents and send them straight over to the advisor while they're there and then. And things very often get sorted within an hour or an hour and a half. And we get very few repeat customers with that, actually, because we are able to be so efficient in using that service, and we get a lot of additional customers coming through the door because it's actually very easy to access and people have a good experience of that. We have legal advice there, and we deal with North and Mid Wales legal partnership and framework for that. It's everything to do with anything civil, so not anything criminal. So it's particularly useful when there's maybe a separation or a custody issue in a house. If we've got somebody that's coming back, for example, they've found they've been scammed, they've had to leave their job, or they've lost their job through reasons of their own that aren't of their making. A wide range of support services there available. Fuel and heating support, it's something that we're all very familiar. Do I heat or eat? And we work with a variety of organisations there, Citizens Advice Bureau, Group Cynefin, Warm Wales as well, to provide information in terms of getting onto the right tariff and dealing with arrears, through to accessing fuel vouchers. But also all of our hubs have a link up whereby they're able to work with a local post office or a news agent. And if we get somebody coming into us, or a partner coming into us where they've got a customer that's in crisis, we're able to provide financial support there and then for people to get fuel and heating and light, etc. on in their house. So what we'll be able to do is ring up the post office or the news agent with which we have an agreement and say, can you put £20 on Mr. Jones's gas and electric cards, please? And then we'll settle up with the post office or news agent later on. That way the cash doesn't go into the hands of the customer, so they actually get the support they need. But it's been really, really critical over these colder months, and it will continue to be so, in terms of, people not having the fuel to heat and eat, people maybe being quite poorly, especially while people have been suffering with respiratory illnesses, There's the one particular situation that I can quote where through our hub in Maesgecon, a lady was discharged from hospital. I think she'd had COVID and was still really struggling with her chest. She went home, she had no electricity, no heating, so she couldn't cook or anything, or even have a hot bath. So we were able to get some meals to her through our local hub. We were able to talk to her about what the situation is with regards to her heating and whatnot. We were able to put some money on her account for her fuel, for her heating and electricity. She was able to have a hot bath, but actually more importantly, she was able to plug a nebulizer in, which meant that she didn't get readmitted to hospital. Things like that are really quite profound, but actually very simple to solve, and we're able to mobilise that very quickly through using our hubs. The next item is access to household white goods. And we have many requests for this just before Christmas. People's cookers blowing up, people needing fridges, people having no microwave, that sort of thing to cook meals with. Through an organisation called Crest in the North Wales. They are repurposers of white and household goods generally, so they're very good at helping people set up their homes when they have nothing. A lot of housing associations link in with them as well, but also we're able to use some of our funding to maybe part fund or fund in its entirety a cooker, microwaves, kettles, that sort of thing. And again, that really helps, you know, if you've got a family or if you're in a vulnerable situation at home, you need to be able to cook foods and you can't, we can support you with the appliances to do that. We've got their mental and physical health support, and that's one of the most widely accessed parts of our support. And surprisingly, we have a wide variety of partners that support us through delivering a large range of interventions. So we have very critical interventions there where people are facing crisis, but we also do a lot of preventive work there. So people are able to come along and join gardening clubs and engage with social prescribing, for example, that are more preventive and reducing isolation, but also linking with some of the topics further down this list, for example, with gender support, etc. as well. You know, we're able to offer specialised support with mental health in those areas too. I think also at this point it's worth mentioning that, you know, for each of these topics, we have a number of different providers because they have different approaches, they have different funding sources, and they're able to offer different services. It's particularly important, I think, with mental and physical health, because we often find that somebody might have come to access support through XYZ organisation, and maybe it's not for them, they've not had a good experience, or they feel they don't want to go back there for whatever reason. So we're able to pick up a different organisation that maybe is more suitable to their needs at that point in their life. We have sensory support there, and that's quite a new addition for us. So we work with an organisation called Sign Sight Sound across North Wales, and they're able to provide all sorts of types of support. For example, translation in terms of signing and understanding the support that's being offered on a wider perspective through the hubs, but also working with employers when helping people to enter the employment market, and also helping them to sort of navigate their way around the world in areas which they might find ordinarily quite difficult. So yes, we have a wide variety of different supports there, and that's been really welcomed across the region. Domestic abuse and substance abuse support as well. We're linking with a large variety of organisations that support people, the victims of domestic abuse. Also a lot of opportunities there to educate people in terms of what domestic abuse actually looks like, and again looking at preventive ways of working with people rather than waiting until the crisis actually happens. And of course substance support as well, lots of organisations there, but of course we work with Betsy Cadwallader's harm reduction services as well. We work with the vans that go out and provide needles and soup and socks and those kind of things as well. So a large variety of different interventions there. The substance abuse support team, Betsy Cadwallader, have also offered training to all of our hubs in terms of what to do if somebody walks in an overdose situation as well. So again, it's providing support to our third sector organisations to be able to be better equipped to deal with what they're going to be having to deal with and what might walk through the door for them. We have gender support there, and we work with a number of organisations that are specialists in that across all our age ranges. So we have information in terms of you know, what it feels like, you know, if you want to investigate what, you know, gender fluidity look like, even if you're going through it yourself, or if maybe you're a family member or a parent of somebody else that's going through that situation, so you can increase the level of your understanding. through to actually helping people experience that situation, access to a variety of groups and clubs where they can go and be somebody else for a few weeks to see how that feels for them, in addition to any mental health support and other support that might be required as part of that journey that they're experiencing in that time. We have multilingual support, and that's not just for English and Welsh, but actually it helps people to access all of the support through our hubs in the language of their choice. So we work with an organisation called EYST, EYST, and they're able to provide that support either physically or virtually as well, and over the form. So they're able to do things like translating documents and also experience counselling, etc., in the language of their choice. We have exploitation and slavery there. So that's both, again, preventive in terms of providing education to people in terms of spotting the signs, but also working with organisations like North Wales Police around county lines, and the various different statutory organisations. For example, the referral mechanism, we can work with people to support them whilst they're waiting for their status to be agreed, etc., in terms of modern slavery and exploitation. Digital inclusion is something that we have a wide range of different interventions there, through to helping people get online. We're able to pay for dongles to get on to plug into the side of people's laptops. In some of our hubs, they're able to provide homework clubs where children can come from 3 till 5. They can get online, they can do their research, and they can upload it. And my son is 12, and all of his homework needs to be uploaded onto Hub. And sometimes I don't know how he'd do his homework if we couldn't get online. But for many children, that's a real challenge. And if you're already in the cycle of do I eat or eat, paying for your internet bill is going to be the least of your worries, really. But what it means, the homework clubs, is that the children can go to school the next day not having to feel embarrassed about not being able to do their homework because they haven't been able to research it and they haven't been able to upload it. And while the children are at the homework club, they can stay for a bit of tea as well for us, and they can go home later on, or the parents can pick them up. It's particularly useful that because many parents that do want to work quite often can't get off work for 3 o'clock or 3:30. So we can hang on to the children for a little while in a supervised environment whilst they're doing the homework, and they can just go home as normal. We have entry to employment there, and sustaining employment. I'll talk about employers a little bit later, but very often a lot of programmes don't work with people that are in employment. We want to obviously help people access employment, and we work with a wide variety of partners, including Welsh Government funded employability agents, as well as DWP and numerous other organisations based in local councils, etc., to find work. We work with organisations that will help people stay in work as well. So, for example, if they're experiencing mental health difficulties or any other difficulties, we work with them and the HR teams or occupational health departments in work to help that person retain their employment as well. And again, going back to some of the other challenges that we've talked about further up the list, if people want to stay in employment or want to achieve employment, but they have other barriers, we're able to work with specialist organisations to make those adaptations in the workplace. And then finally, last but certainly not least, a wide variety of access to social prescribing programmes. Again, wanting to take that preventive approach, not waiting until somebody hits the crisis point, but actually helping them to reduce isolation, engage in activities that will increase their social networking, helps to alleviate some mental health difficulties and many other challenges that they're facing in their life as well. So those are the levels of support that we offer as a core module. Many of our hubs offer different types of support as well, and they're always tailored to what the community is asking for. Some of our hubs won't offer every single one of these because maybe they feel that there isn't the need in the community at that point to offer that type of support. But we work very closely with our residents and we listen to them and what they like and what they want. We're very much attuned to being mobilising very quickly through our support networks. And we're always looking for new partners as well. So if we have people on the call today that aren't already linked up with our community support hubs, please do get in touch because we don't want to exclude people. We don't have an exclusive list for being a provider to one of our hubs. The important thing is that we're able to provide a service to people that people can access in an easier way under one roof, whether that's physically or virtually. So how do we offer the support? Well, unsurprisingly, we offer it in person. You can drop in, you can make an appointment, you can ring up, you can telephone us, you can access all of the support virtually via Zoom. One of the things we found that's been particularly popular is accessing the support for mental health support virtually. The reason for that is that all of our hubs have a small space, a room that's quiet and private, confidential, and safe, where they can actually engage in counselling and any sort of therapy over a screen. Many people want to do that, so they're not actually looking at people face to face, because that's great in terms of protecting their dignity and making them feel more comfortable. What we actually find is a lot of young people engage with counselling and mental health support actually using typing. They don't want to talk, they don't want to have the conversation, but they're really happy to sit there and type how they feel, and the person that's doing the counselling or offering support at the other end will respond in the same way. That works really, really well. As I mentioned, we use WhatsApp and FaceTime, and also people can actually access the support using links as well. So we'll engage via social media, and I'll talk to you a little bit about that on the next slide. So referring partners here, we've got a wide variety of referring organisations, and as I mentioned earlier on, you know, people are very welcome to walk through our doors. I'm sorry, I'm just turning my heater on. It's a bit cold in here. They're very welcome to walk through our doors, and they can link up via social media as well. We obviously understand that not everyone has links to social media, and that's absolutely okay. So one of the things that we do on a regular basis, and certainly when our hub's set up, is we put leaflets together, and there is a small element of money available for marketing and promotion within the budgets for our hubs. They put a leaflet together offering all the services, and they work with local organisations and counsellors and maybe walking groups to make sure a leaflet gets through the door, the letterbox of every single door in that area. So people know that the service is there, they don't have to necessarily rely on social media. We also have the social media links where you can click on the link and you can type in the form, and it's literally 3 questions long. What's your name? How do you want us to contact you? And what do you think you might want help with? But that question isn't mandatory. Then that comes through to us, then we can get in contact with people directly. And all of our partners and all our referring organisations can also use a link as well. We have, of course, cross-partner referral. We work closely with local pharmacies, so we have our leaflets in the pharmacies and our posters up around the town. We work with GPs, and we've had conversations with all of our GP clusters across North Wales. And all our clusters said, you know, approximately 90% of their patients that they see have some sort of social or well-being need. And so we get quite a few referrals from our GPs, making sure that their patients are linked in with us, that they're accessing the various different types of support services that we're able to offer. And very often, you know, somebody is poorly clinically because they have a chronic social or well-being need, or maybe because they're chronically poorly, they have that need as well. So we're able to work at both ends of the spectrum there. We have the local authority tracing teams whilst they're still around to support people that have to isolate. We work with Public Health Wales and all their different education programmes. We've mentioned the cookery classes and dietetics. There's also smoking cessation, the green outdoors, lots of different things that Public Health Wales do. We work with long COVID rehabilitation and support people that are dealing with the long-term effects of COVID. We work with North Wales Police, and we have a very good relationship with them in terms of their prevent strategy. So when the officers go to the houses of people and they identify a need, they can refer people to our hubs, or they can actually give that person the information they can refer themselves. We're also quite very involved with their Christmas planning. Very often we find that this sort of services, voluntary services, aren't always open as usual over the Christmas and New Year period, and of course that's where a lot of crises happen. So this year we're going to be working with North Wales Police in terms of their Christmas planning, and we're going to start that in a couple of months' time, so that's really good news. We have North Wales Fire and Rescue Service when they do the smoke detectors and the slips, trips and falls, under the same sort of methodology as North Wales Police. Of course, we work with our social services teams, with Job Centre Plus and other statutory teams, organisations and agencies. So again, you know, there's lots of organisations out there. If we're not linked up with you already and you'd like to be referring people to us for our support, then please do get in touch. There's no access criteria, so anyone can use our services. So there can be people in work, out of work, doesn't matter where you live, doesn't matter whether you're claiming benefits or not, because we want to offer a preventive approach as well as a reactive approach as well. We want to be able to stop people from getting to crisis point at some point. We're not going to be able to do that all the time, but if anybody can wander through our doors and access any of our supports, then we hope to be able to make some inroads with that in the longer term. I think also one of the things that's worth mentioning is our delivery model. It's very easy to assume that all we do is refer people across, and it's just another cross-referral mechanism, and it's not. And I'll talk about that later on, but we do properly case manage our customers that come through the door. So we're able to look at their journey, we're able to record their journey and see what's going on for them and see what works for them. So we've got some lessons learned here. We conducted a review at the end of October last year, and we're in the process of conducting a review to be done by the end of March as well, in terms of the pilot project. One of the big lessons that we found was keeping up the LFD demand, and that was actually quite a nice one to have, because it meant that people were being responsible in their own community for their own health, and that's always a really positive sign. Even in some of our most disadvantaged communities, people were still coming down to the hub every week to pick up their packet of LFDs, and that's great. We're obviously in the situation at the moment where we're waiting for Welsh Government's transition strategy, for example, for COVID. I'm hoping that the supply of LFDs to our hubs will continue. That is looking likely, but we need to wait until the document's out until we find out for sure. But LFD demand was a real challenge for us, especially around Christmas when Omicron appeared, and people were sort of testing very regularly, and that's great as well. But keeping up the LFD demand is a big situation for us. As I mentioned earlier on in the presentation, branding. When we initially set up in June, July, we called ourselves COVID Support Hubs. We changed our name around October, November time. The reason for that was that the COVID ended up being a bit of a stigma, and people were thinking, actually, you can only come into one of our hubs if you've got COVID, or if you've had COVID, or if you're associated with COVID in some way. And that was meaning, obviously, we weren't being as equitable as we can in terms of making sure that support was accessible. So then we moved to community support hubs. That worked, I'm really pleased to say. And also it gives us the opportunity to have the longevity there, and I'll talk about funding later on, but to actually be able to sustain that service long term. It is, as it says on this tin, it is a support hub for the community, and that's worked really well for us. Supporting partners to move from operating to performing. That has been a real challenge, and making time to manage as well. I think sometimes there's a perception that when we give money to people that they carry on doing more of the same as what they've already done. But what we actually wanted to do was introduce proper case management, so we can trace Mrs. Jones from when she walks through the door and to see what she wants to do, for example, with regards to, does she need food, does she need some support with her bills, etc. We can get on the phone to talk to the organisation, and they can have a discussion with Mrs. Jones there and then, or they can link up with her virtually in a different room, or we can make an appointment for Mrs. Jones to see somebody at the hub or over the phone or using WhatsApp. But after that appointment, we'll ring at Mrs. Jones and see how she got on. Was it useful? Did it work? Do we need more of the same? Did she not enjoy it? Did she not turn up? What happened? And working out what's what the next step is that we need to refer her to a different type of service. Have we identified something else that needs addressing at that time? And it's making sure that Mrs. Jones is okay, basically. And if she doesn't want to engage anymore, that's totally fine. It's absolutely fine. But if there's something we can do to continue with her engagement, then that's great. Obviously, if she doesn't want to engage, there's no sanctions, nothing's going to go wrong, nothing's going to happen. It's entirely her choice. But as long as she knows that we're there, again, when she wants to come back, if that happens. And also making time to manage as well. So looking at where the people come to that visit our hubs, that access our hubs, are they all from one particular area? Are they a particular age range? Are they from a particular social circumstance? And if so, do we need to work out how we target other people? How do we raise the profile of the support we're able to offer with different groups of people? And I think that's really important. And we do this using a system called Elemental, and all of our cases are recorded in that system. And we're able to look at, where our people are coming from, what's the most popular services, at what times of the year, how they like to access them, and all that different intelligence. And that constantly helps us identify how best to respond to the needs of the community and how the needs of that community might be changing as well. Excuse me. We've got there succeeding the change in a fast-paced environment, and life is very difficult at the moment. We're coming out of COVID, but are we? Life is getting back to normal. People are looking forward to maybe not self-isolating in the long term. What's going to be happening with testing? Are people starting to go back to work? Are the jobs there? Do we have the skills? Can they do the job that they used to do? Are they now in poverty, whereas they've never previously been in poverty before? Lots of different things going on in our communities, and we need to make sure that we're able to adapt and mobilise our service very quickly to the response of what our community is asking for. Excuse me. And finally there, we've got understanding the real value of partnership working. Partnership is our biggest asset, but it's also our weakest link. And as I mentioned earlier, we have over 160 organisations working alongside us. And all of those organisations, believe in the same values, they think the same way, they want the very best for the customer. And they're not precious about their customers as well. And are very much aware that, working in the third sector is a difficult place to work. Very often you're faced with uncertainty of funding every 12 months. Can you keep your staff? Are they going to be okay? Etc. And what we want to do through the hubs is provide some element of sustainability long term for our third sector as well, because then that will enable them to work in the true sense of partnership, not being worried about whether they're going to lose a customer to a different organisation, but actually being able to focus more of the time than they already do on making sure we get the right outcomes for our customers. That's very important. And to support that, what we're looking at is a 5-year funding programme, so we can actually make some sustainable changes to the third sector and give them the credit that they really deserve for the hard work that they do. Make sure that they don't have to panic every 12 months about keeping their funding, but also that our customers get used to a service being there for a long period of time, that they gradually over time lose any scepticism or cynicism they might have about the service, and that it becomes a place that you just wander into if you want to know about something, rather than having the stigma of going there because you've got a problem. So we've got there our future potential. And of course, we want to increase our hub coverage and improve equity of access to more people. I mentioned employers earlier, and that's something we want to develop a lot in the next 12 months, working with organisations to support their HR teams, support their occupational health teams, to help link their employees in with our services as and when they see them, if they're having difficulties at home. Working with students as well. Many education establishments already have really, really good wellbeing facilities. But what happens when the students aren't there? What happens if the student doesn't feel comfortable going to them for whatever reason, or they've not had a great experience? And what happens when they leave education as well? And we really want to link in with those that group of people to make sure they don't enter crisis at the most one of the most important points of their life. We've got there working with primary care, secondary care, rehabilitation, and also with care in the community. So this is where we hope to have some impact on patient flows over time. So working with primary care, we've talked about GPs, etc., supporting them. We also talk about people that maybe have suffered, for example, strokes, cardiac illnesses, and some more profound clinical illnesses, whereby they could do with a bit of support in the community afterwards. Is that going to, panada scores, chat and coffee a couple of times a week? Is it going to do a bit of gardening? Is it just a random ramblers group? Those sorts of things that will help their rehabilitation. And also linking up with carers in the community to support them with a wide variety of different interventions, but also help with the people that they care for as well. We've got accident and emergency there. You're all familiar with the concept that very often if people that can't get into their GPs will then go to A&E later on in the day, and really actually they're going there with something that maybe could have been prevented by accessing the common ailment scheme. Not always, but maybe. And so there's of course an impact there on patient flows as well that we're hoping to have by some of that preventive work. working with the Welsh Ambulance Service Trust, prisons, National Offender Management, and also veterans. And finally, working with emergency planning and response. And you know, 2 examples that I can think of straight off the top of my head are, for example, a large organisation making large numbers of redundancies, so we can get involved very early on and support with job support, but also helping people to deal with their debts, manage their bills, etc. And helping them to maybe get back on their feet a bit quicker than maybe they would have done ordinarily. And also things like flooding, for example, being a centre of refuge, flooding, keeping track of people that have been dispersed because they can't go back to their homes, collating of donations, all those sorts of things. They do a lot of that in New Zealand, where they have a lot of community support hubs, and they also double up as emergency planning and response places as well. So ultimately, the long-term impact of the hubs will be, through sustained funding, is to increase levels of personal and community resilience over time. And I really hope that we'll have the opportunity to break some of those cycles of generationally learned poverty. And really, that's one of the reasons that I wanted to come and talk about it today, because very often we find through our working that if we're having something to do with a parent or a carer or a guardian in a household, and things are changing for the better, the child will see things changing for the better, whether they notice it deliberately or subconsciously. And then I hope they will go on to learn that actually problems can be solved in the long term, rather than feeling this is my life, this is my lot, and then them going into a life of poverty as well. I think that's really, really very, very important. It's obviously not going to be achieved overnight, and that's the reason for having long-term sustainable funding regimes, so we can make some difference. So this is our future model then. As I mentioned earlier before, we've got community support hubs in the middle there, with case management, partnership management, and managing the hub. To the left there in the blue, you can see community engagement, which is the usual thing that we do. Education engagement, engaging with educational establishments and students, etc., and helping them to link in with support. And also employer engagement as well. So working with all the organisations that do employability, but actually working with employers as well, not to get the vacancies, but again, to make sure we're linking their employees in with the support that's available to them. And that can have really remarkable impacts on things like long-term absenteeism and also presenteeism as well, when somebody is actually going to work, but they're not really with it when they're going to work. And then in the red on the right hand side, we've got links with primary care, secondary care, social and community care, emergency services and statutory services. And at the bottom there, we've got our stakeholders. So there's still a lot of work to do. I think it's a good solid model that can be replicated in any other area across Wales and further afield. As I've said before, you know, it's not rocket science. And, you know, we haven't reinvented the wheel, but what we have done, I think, is taken advantage of the catalyst that COVID has provided us with and trying to turn it around into something positive that we can make a difference in our communities. And then actually other people can link in with as well. And I'll put my contact details up at the bottom here. If you'd like to work with us through the Hub Network, please do get in touch. The more partners we have, the better service we're able to offer our customers. And if you are a hub already and you'd like to link in with our partnership, then please do so. You know, we offer lots of opportunities to link in with wide ranges of services, lots of free training, the opportunity to work with our other hubs across the region, to share ideas, best practice, budgeting up, all those sorts of things. And really, it's all about making that money work harder for us and being more efficient and working smarter and not necessarily harder. So I'll stop waffling on for now, and I'd be really happy to take any questions.
Thank you so much, Lisa, and I'm so pleased that your voice held out.
Only just.
Thank you very much. For me, it was just amazing to see all of the support and such detailed support, but also you looking at prevention and not just intervention, and I think that's crucial going forward. But yeah, it's so encouraging. Just before I go on to questions, this is really for everybody. There have been a few comments about where can we find out more information about other hubs happening across Wales. So what I'd like to do, if you're in a hub or you are able to offer information from across Wales to others that are on the call, if you're happy to do that, could you send Louise O'Neill at Children in Wales your email, send her an email just with information about what you can offer and any information that you have. And then if you're obviously happy to do that, we can add your email address and contact details into the follow-up email that we send to everybody after this webinar. So hopefully then we can help network. So I know somebody was looking for information in an Iron Bevan, and we can take that email address and put it in. So if you contact Louise O'Neill just with what you can offer and support for others, that would be really great. Thank you. And Louise is the my colleague who sent you the information about the webinar. So hopefully you've got her email address somewhere.